Hello, I'm Armida Carr, bilingual speech-language pathologist, owner, and founder of New Horizon Therapy. Welcome back to Therapy Thursday, where I talk about a topic or answer your questions as it relates to speech or occupational therapy. Today, I will be talking about aphasia in adults. Aphasia is a language disorder that occurs after a stroke, a brain injury, car accident, or other, maybe there's a tumor growing in and around in the head somewhere. But it basically starts affecting the way we speak, the way we think. Some people describe it as feeling really foggy. Other people will say, my family member, they started slurring their words. I didn't know what they were saying. Or sometimes it'll be as dramatic as from one day to the next where you just see there's a loss of language. And aphasia is an important, when those things are seen or in family members or diagnosed or, you've ended up in the hospital. I always say it is important to get care or speech right away. When it is treated early on, the chances of recovery and recovering the language that was lost is greater than if a person were to wait longer. And I always say, when in doubt, give us a call and we'd be more than happy to answer the questions. If you're uncertain, is this a speech-related problem? But it is something that occurs in the brain, that it has been injured in some way or form. And when you're going through the recovery process, it is important to activate those neurons and activate the brain again, because I always describe it as having a bruise in the brain, and that bruise is trying to heal. So when you're giving it the proper input with language or speech, it starts to grow and those neurons start to fire and it starts to rebuild. Our brain is an amazing piece of the body. So we can kind of, when you come in, we see where you're at. We do testing on different areas of the brain. The language test that I use kind of targets different areas that you might not even think of, because I've had patients that come in and say, yeah, I'm perfectly fine. I don't know why the doctor sent me. And when we sit down and start going through the areas at the end, they realize, wow, I didn't realize that I was affected in that way. So sometimes it's hard to diagnose. Sometimes it's hard to tell, especially if you're not in the medical field or around, this event every day. But again, give us a call and I'd be more than happy to answer your questions or talk you through it and, what the next step should be. So thank you so much for being with me today, and I hope that answered some questions that I've received about aphasia in adults or what it looks like. If you have any questions, feel free to send them over and I'd be more than happy to address them again. Thank you so much. Bye-bye.